Hello, welcome to Module 3 of the Introductory Sessions of Implementation Science, brought to you by the Implementation Network from Ireland and Northern Ireland. My name is Jennifer Waters from the Center of Effective Services. Our third module focuses on implementation science models and frameworks. Implementation frameworks provide a conceptual model of implementation, serving to describe specific steps in the planning and execution of implementation and highlighting potential pitfalls. The past decade has seen an increase in the number of frameworks appearing in implementation science research. In 2012, the count was at more than 60 frameworks. In 2017, it was at 100, and now it currently stands at approximately 107. These frameworks differ in terms of assumptions, aims, context, such as policy and practice, and sectors, such as public health and child welfare. The terms theory, model, and framework are often used interchangeably in practice. However, in this module, we will be using these concepts as set out in the implementation science literature, such as that described by Nilsson in his 2015 paper, Making Sense of Implementation Theories, Models, and Frameworks. We will define implementation framework as an overarching structure or outline of how concepts or variables are interrelated and are presumed to influence the outcome of an intervention. We will define an implementation model as a more narrow set of variables of focus. These tend to be descriptive in nature. And we will define an implementation theory as a set of principles designed to structure our observation, understanding, and explanation of implementation processes. A good theory provides a clear explanation of how and why specific relationships lead to specific events. While implementation science is producing growing evidence of generalizable lessons for more effective implementation, the evidence for any individual implementation framework is limited. There is also significant overlap among many of the frameworks. As a result, there is a growing emphasis on combining and improving existing frameworks, and on using the most relevant elements of any one or more frameworks given a specific context. This is why we always focus on the core elements of implementation, which was covered in Module 2. The core elements include implementation stages, enablers and barriers, and the context for implementation. The key aims of utilizing theories, models, and frameworks in implementation science can be identified as 1. To depict or direct the process of transforming research into practical application, 2. To comprehend and/or explain the factors that impact the outcomes of implementation, and 3. To assess the implementation itself. Depending on the intention of the framework, they can be useful in guiding the implementation process, which can be consulted as a first step in changing how a service or intervention is implemented, identifying implementation barriers and facilitators across multiple levels of context, assessing readiness for implementation by examining staff readiness, organizational culture, and climate and implementation planning, developing, testing, and applying implementation strategies and approaches, and conceptualizing a problem or research question, which can provide guidance in conceptualizing the problem or topic which needs investigation. According to Nilsson, there are 5 categories of frameworks in implementation science. Determinant frameworks, which specify barriers and enablers that influence implementation outcomes. Their overarching aim is to understand and/or explain influences on implementation outcomes, such as predicting outcomes or interpreting outcomes retrospectively. We will address CFIR, the Consolidated Framework for Implementation Research, and the Active Implementation Framework in this lesson. Another model is process models, which specify steps in the process of translating research into practice, including the implementation and use of research. We will focus on the Quality Implementation Framework as an example of this type of framework. Classic theories. These emanate from external fields such as organizational theory, sociology, and psychology. These external theories can be applied to provide understanding and/or explanation of aspects of implementation. These might include change management theories, diffusion theories, social cognitive theories, theories concerning cognitive processes and decision-making. The COM-B model, Capacity, Opportunities, Motivation, and Behavior Framework, is an example of such theories, which we will review later. Implementation theories. These theories have been developed by implementation research from scratch or by adapting existing theories and concepts, and therefore provide deep understanding of aspects of implementation. And finally, evaluation frameworks. These frameworks specify aspects of implementation that could be evaluated to determine implementation success. RE-AIM, Reach, Effectiveness, Adoption, Implementation, and Maintenance, is an example of this type of framework, which we will be reviewing later. CFIR, or the Consolidated Framework for Implementation Research, is the leading example of a determinant framework. The CFIR offers a practical framework to address the intricate, interrelated, and multidimensional nature of constructs in the real world by integrating and harmonizing pivotal concepts from established implementation theories. It serves as a tool to facilitate formative evaluations and to expand the repository of implementation knowledge across various studies and environments. The CIFER comprises of 5 major domains: the intervention, inner and outer setting, the individuals involved, and the process by which implementation is accomplished. These domains interact in rich and complex ways to influence implementation effectiveness. Here, you can see a simplified illustration of the CIFER domains. The CIFER's broad framework aids in examining crucial aspects that might be faced during the rollout through early stage evaluations. As of the time of recording, the CIFER framework is being updated. The Active Implementation Framework is another example of a determinant framework. It is useful for identifying which mechanisms and implementation strategies are best suited towards the selected innovation or intervention. This framework was based on a synthesis of other implementation literature and has been used to facilitate the implementation and improvement of comprehensive medication management, optimizing medication use and improving care for primary care patients. The Active Implementation Framework has 4 main components: implementation drivers, implementation stages, implementation teams, and improvement cycles, and is shown to be useful to developing local capacity, leadership, improving implementation fidelity, and overall promoting positive outcomes. Implementation stages are the activities necessary for change of services and implementation. Improvement cycles are processes that use data-driven insights to identify factors that may inhibit or enable an implementation's success and impact. Implementation drivers are central components of a project's infrastructure that are needed to support the change in practice, organization, or system associated with an intervention. There are 3 kinds of implementation drivers: competency drivers, organization drivers, and leadership drivers. When used together, these drivers can ensure high fidelity and a sustainable implementation. Competency drivers pertain to the abilities of practitioners and supervisors to implement a program or innovation. Organization drivers pertain to ensuring the environment into which the intervention is being introduced is hospitable. Organization drivers ensure that competency drivers are accessible and that the data is utilized for continuous improvement. Leadership drivers ensure that leaders use strategies applicable to different challenges and that diverse leadership is available at every level and stage of the system. The drivers complement each other, as the weaknesses of one driver may be compensated by the strengths of other drivers, as outlined by Metz in her 2013 paper. The next framework we'll introduce is an example of a process model, the Quality Implementation Framework. The Quality Implementation Framework is considered a meta-framework, identifying critical steps and the actions associated with each step in the implementation process. If utilized, the framework aims to achieve quality implementation. Implementation is not something that is all or nothing. Its success varies in terms of low or high quality of implementation. The Quality Information Framework outlines 14 steps from across the literature that ensures that high-quality implementation is achieved, steps which are separated into 4 phases. In the first, assessment phase, the required resources, context compatibility, and team readiness are assessed, and the potential need for adaptation of an approach is discussed. Once resourcing, project suitability, and capability of the team are assessed, the required resources can be acquired and appropriate stakeholders can be consulted. In the assessment phase, staff training and recruitment may also take place. The second, structural phase, is where the implementation team is created and the implementation plan is drawn. It is in this phase, roles and responsibilities are allotted to implementation team members and tasks and timelines are established. The third, implementation support phase, pertains to the provision of assistance for practical problems that inevitably arise upon the introduction of an intervention, innovation, etc. If practitioners require greater training in light of the intervention, or scheduling conflicts emerge, attention and resources must be paid to them. Additionally, feedback mechanisms for the implementation success are established, and data regarding the performance of the intervention is communicated to all involved in the intervention, including practitioners, administrators, and stakeholders. The fourth and final, future improvements phase, relates to the learning experience and reflection of all involved in the implementation. Critical reflection alongside collaborative relationships with all involved in the implementation process can ensure that practitioners are better equipped to ensure implementation strategies are successful in the future. To conclude, the Quality Implementation Framework approaches implementation as a systematic series of steps and associated activities that can ensure the implementation of an intervention is achieved to a high quality, and that tasks such as assessment, negotiation, collaboration, and self-reflection increase the likelihood of high-quality implementation. An example of a classic theory of implementation is the COM-B system and behavior change wheel, which focuses on the behavioral changes underlying an improved design and implementation process. The COM-B system is a model of behavior that is used to identify what needs to change to cause desired behavior at the individual, practitioner, or organization level. The framework has its foundations in the work of behavioral theorists and U.S. criminal law, whose understandings of attributing volition, therefore guilt, to an act identified capability, C, opportunity, O, and motive, M, as the three necessary conditions for a person's conscious behavior. The COM-B system is a model of behavior that is useful to identify what needs to change to cause desired behavior at the individual, practitioner, or organization level. The framework has its foundations in works of behavioral theorists and U.S. criminal law, whose understandings of attributing volition, therefore guilt, to an act identified capability, C, opportunity, O, and motive, M, as the three necessary conditions for a person's conscious behavior. The hub of the behavior change wheel is composed of the three necessary conditions, again, capability, opportunity, and motivation, and surrounded by two circles. The inner circle contains the 9 interventions categorized by their functions, and an outer circle containing the 7 policy categories. The model is a wheel and not linear because it was understood by researchers that components within and throughout each circle in the wheel interact with each other and will therefore be visualized accordingly. Here you can see the behavior change wheel with its interacting and nonlinear elements. Note that the policy categories are on the outer circle for a reason. They are separated from the behavior held by the intervention circle, as it was understood that interventions that policies support or enable are what affect behavior. By understanding the dynamics of the relationship between the components of behavior, practitioners are able to isolate which component to focus on and the associated enablers and barriers of each that may bring about or inhibit a change in behavior. The COM-B behavior wheel can be applied to any level of an organization, not just individuals, in order to influence the behaviors at the heart of a successful implementation initiative. An example of an implementation theory framework is the RE-AIM framework. RE-AIM is an acronym for Reach, Effectiveness, Adoption, Implementation, and Maintenance. Originally developed for consistent reporting and reviewing of research results, the current framework focuses on encouraging evidence-based and sustainable interventions in real-world settings. RE-AIM is a more holistic model where environmental factors are considered and allows for evaluations of intervention effectiveness to be more fine-tuned for each setting. The creators of RE-AIM defined the impact of an intervention's reach as the product of a program's reach in the efficacy of an intervention. The R and E at the participant level are expanded upon with 3 more dimensions relating to the context and organization in which the intervention is being undertaken. Specifically, a program's adoption, or A, implementation, or I, and maintenance, M. Here you can see the elements of the RE-AIM framework and associated questions to answer when applying it. Another example of an implementation theory framework is the normalization process theory. The normalization process theory framework focuses on implementing highly complex interventions to the extent that they are normalized into everyday routine. Normalization process theory is an explanatory model that focuses on the work individual practitioners do to integrate a behavior, action, or process into an organizational norm. By providing insight on what everyday practitioners do, managers, researchers, and clinicians are better able to understand the dynamics of everyday processes and how to invoke change in these processes. The starting point of the theory is that to understand the embedding of a practice, we must look at what people actually do and how they work. It's a theory of action. Normalization process theory was developed in light of 3 core values. 1, that complex interventions become routinely embedded in organizational and professional context as a result of people working individually and collectively to implement them. To iterate, embedding is dependent on socially patterned implementation work. 2, that the activity of implementation is operationalized through 4 generative mechanisms, which will be outlined in the next slide. And 3, that integration of a complex intervention requires continuous investment and effort by people working together to sustain the intervention. To go more deeply into point number 2, The four concepts, or generative mechanisms identified to be operationalized in a successful implementation and embedding are 1. Coherence, 2. Cognitive participation, 3. Collective action, and 4. Reflexive monitoring. The initiative needs to be straightforward and make sense to every participant, making coherence a core concept for embedding a behavior into the norm. Acts like differentiation, communal and individual specification, and internalization can allow for all participants to understand an initiative and change the behavior in a way that effectively facilitates embedding. The production and reproduction of an action leading to its embedding not only requires people to understand the actions they're taking, but to be themselves proactive in the legitimization and sustainability of an action, requiring cognitive participation. Activities like enrollment, initiation, activation, and legitimation of an action are required in this element. Actors must collectively invest in an action, meaning the task itself must be tailored to the skills, individuals, and context of the intervention selected to be embedded. The ability to gauge whether an action is being implemented successfully or embedded depends on methods of monitoring we use. Reflexive monitoring allows for multiple assessments of an intervention or action's success, sustainability, and allows for enablers and barriers to be identified. By using both communal and individual appraisal, a multi-level and likely mixed methods approach can determine whether an action truly is effective and to the extent that the action may become embedded. Arranging the action in a system, gathering feedback, and reconfiguring the approach in light of potential barriers ensure the action can become embedded. Our final framework is an evaluation framework called the Proctor taxonomy. The Proctor framework arose to identify whether an intervention itself was effective, or if the implementation of an intervention was what led to an ineffective outcome. They hold that implementation research requires outcomes that are conceptually and empirically distinct from those of service and clinical outcomes. The framework has four key objectives. 1. Advancing conceptualization of implementation outcomes by distinguishing them from service and clinical outcomes. 2. Advancing the clarity of implementation terminology by nominating heuristic definitions of implementation outcomes, or establishing a taxonomy of outcomes. 3. Reflecting upon the field's current language, conceptual definitions, and approaches to operationalizing implementation outcomes. And 4. Proposing future research for these key constructs and their interrelationships. The taxonomy of implementation outcomes includes reference to 8 key outcomes: acceptability, adoption, appropriateness, feasibility, fidelity, implementation cost, penetration, and sustainability. At the level of analysis, theoretical basis, other terms listed in the literature, salience by implementation stage, and available measurement are all provided for each outcome. The application of Proctor's taxonomy can include the modeling of an intervention's outcomes through various equations, as well as the interrelationship between outcomes. Selecting the right implementation framework requires serious discussion amongst the implementation team and leadership, as well as any required external expertise. Terminological vagueness, frameworks chosen with little contextual knowledge or applicability, and limited training in implementation science as a whole can be large obstacles to successful implementation and any intended goal of an intervention. Hopefully, lessons like today's and the other CES modules and materials can equip you and other decision makers with greater knowledge of implementation and the processes surrounding implementation in order for your endeavors to be successful. Clearly outlining your overall aim provides a clear and consistent foundation for your intervention to be implemented with fidelity. It is important to note that as every context and aim may be unique, multiple frameworks and different elements from multiple frameworks can be applied to your implementation design and your research. By understanding the frameworks we provided as well as their constituent elements, you and your team have a strong basis to begin your implementation design, iterating the process and refining your strategy as you proceed. That brings us to the end of our third module in our Implementation Science series. Thank you for your attention, and we encourage you to join us for our final module, Monitoring and Evaluation. If you are interested in further trainings with CES, please contact us at implementation@effectiveservices.org.